Welcome to the Mojo Story. I'm Barkha Dutt. Forgive me for this croaky voice this evening. It's because of a laryngitis, but I felt that we must have a conversation with one of the foremost global experts of our time on Omicron. So here we are, and let's take a look at what we know so far. In India, the debate is continuing over booster shots, yes or no. Even if we boost, what will we boost with? That's the big question. This, even as Pfizer says it has a therapeutic intervention that works, and Oxford says the AstraZeneca third shot is working. So, should India be boosting with Covishield? Also, the reports from South Africa suggest that Omicron thankfully continues to be mild. The vaccines are holding against severe disease and hospitalization. Understanding what could be the Omicron wave, we are going to talk today to Ashish K. He is at the Brown University. He's a familiar guest on this platform and really somebody we turn to when we're anxious because he's calming, he's measured, and above all, he's knowledgeable. Welcome back, Ashish, and I'm sorry for this croaky voice today. But I just felt we needed to have you and understand your perspective. And I want to say to you, here we are again. But is it deja vu or is there a big difference from this time last year?
Yeah, Barkha, first of all, I hope you feel better soon.
Thank you.
This is not deja vu. We are not in the same place we were. So let's talk about the moment we are in. I don't mean to underestimate Omicron. It's a very serious problem. It will become, I believe, the dominant variant around the world. We will see a large spike of cases in India, as we have seen in South Africa and UK and Europe and the United States. So there's no reason to think that there will not be a big spike of cases. The real question is what will be the consequences of that for people's health and well-being. And the reason I am much more optimistic is because we have, as a world, but certainly India has done a phenomenal job of vaccinating people, particularly high-risk people. That I think is going to be very, very helpful. Obviously, the Delta wave created a lot of immunity. Many people got infected. That's also going to help. So I expect a large surge of cases, but I am hopeful that we will not see a large surge of hospitalizations and deaths. There is still important work to be done to make sure that happens, but we're in a different place than where we were with the Delta wave.
And that is very good to hear. In fact, the South African doctors I've been talking to are confirming that even the symptoms are very, very different. What is the feedback you're getting on that? For example, there is no depleting oxygen to start with.
Yeah, the single biggest question that comes up with this virus, whether it's Delta, Omicron, is how much lung involvement is happening. Because once the lungs get involved, that's the COVID pneumonia that leads people to get very sick, that they need oxygen, they end up dying. Again, very preliminary evidence says that, especially for people who are vaccinated or people who've had a prior infection, that they tend to get less of that COVID pneumonia. That's the critical thing that makes this a milder disease for that population. Whether it's milder for somebody who's unvaccinated and has never been infected, I don't actually know that it is. And we have to be very careful before we draw that conclusion. It might be. But people who've been previously infected or people who've been vaccinated, it does appear to be milder. And that's great. That's actually what we would expect immunity to do for us, make it a milder disease.
So let's talk about boosters. The South Africans are not boosting, and the cases have remained mild there. The United States and the United Kingdom are boosting. Where do you weigh in on the third shot?
Yeah, so let's talk about what we know about what's happening in South Africa and versus UK and the US. And I actually believe very clearly that I do think people should be getting boosted if they're in a high risk category. But let me explain my reasoning. What we've seen in South Africa, what we've seen in the UK, US, across Europe, is if you've had 2 shots, you still are having very, very high rates of breakthrough infections. Most of those are mild. But for elderly people, a 70-year-old or somebody with chronic diseases, those breakthrough infections can actually be quite serious. If you boost, you get less breakthrough infections, and you make it for those high-risk people less serious as well. So I think India's strategy right now should be for high-risk individuals, elderly people, people with chronic diseases, I think a booster shot would be useful. The one caveat, and I've heard other people bring this up, is what if you've been previously infected and then have gotten 2 shots? That's like being boosted. Anybody who's been previously infected and has had 2 shots probably does not need a booster. But I would, if I were running policy in India, I would focus on high risk people and get them boosted. I would also get healthcare workers boosted, because even if they're low risk themselves, if they have a breakthrough infection, even if it's mild, they're out of commission for 10 days. That's going to make it very hard for us to keep hospitals going. So healthcare workers, high risk people, I think actually would benefit from a booster, and it would be good for the country to have that.
All right, but what does India boost with? Because we don't have the mRNA vaccine. Oxford says the AstraZeneca is working as a third shot, but there is some science that says the vaccine should be mixed while boosting.
Yeah, there's been a lot on this, Barkha. There's been a lot of debate. And do you need an mRNA? Do you need? My personal take is at this moment, the data says it almost doesn't matter. I mean, maybe there's a marginal benefit of boosting with something else. But I've got a booster here in the US. I got the same one that I got the first 2 shots. I think if you've gotten a Covishield 2 shots, a boosting with another Covishield is fine. India, of course, also has Covaxin. India is also working on the Novavax vaccine. So there are going to be other options in the days and weeks ahead. There's a little bit of a theoretical benefit to mixing and matching, but I think it's not that important. I think that any third shot is really the most important thing.
So you would say that because Covaxin has a volume problem, as you know, in India,
Yep.
Novavax is still some time away. We have really only Covishield. Would you say Indians should be boosted, the high risk category, with a third shot of Covishield?
Yes. To me, the data is clear enough at this point that high-risk people and healthcare workers should get boosted with that Covishield third shot. Look, there are people who say, well, all the data isn't in. In a pandemic, you can't wait for all the data. You have to look at the data that's out there. There's good data from the UK on Covishield. They, of course, the AstraZeneca vaccine. There's good data from elsewhere. I think it's more than enough data that's how I would move forward.
Where do you see the debate around long COVID? And I ask you this because there are people who are saying even if Omicron is mild, we don't know what impact it's having on the body. I've also seen studies that are now looking at COVID as a neurological problem and not just a respiratory one. Can you speak to that?
Yeah, absolutely. So this issue of long COVID is real. First of all, there are clearly people who have infections who end up going on to develop long COVID symptoms. Some of them are respiratory, but many of them are neurological. And maybe the neurological ones in the long run may even be more important. We don't know. The big question is, will Omicron cause the same level? And what if you are vaccinated and have a breakthrough infection? All the data right now says people who are vaccinated and have a breakthrough infection, much, much lower risk of developing long COVID. Even if they do, lower risk of developing, the severity of the symptoms are lower. So I believe that vaccinations are going to be a very important part of preventing long COVID, but we don't have all the data. And it is still possible, though I think less likely, that if you have a breakthrough infection, you're boosted or are well vaccinated, the chances of you getting long COVID are small, but probably not zero.
Omicron has been grabbed, Ashish, by the anti vaxxers to make the case that vaccines are not working. And I want us to be very, very careful when we talk about breakthrough infections. A lot of people leap on that and say, hey, there's the proof. What's the point of getting vaccinated? The other big debate is natural immunity vis a vis the vaccine. Can you
Yep.
talk about both these things?
Absolutely. So let's talk about what we know about natural immunity or infection-induced immunity versus vaccinations. There is no question that natural immunity or infection-induced immunity does give you some level of protection. The question is it as good as getting vaccinated? The data is, in my mind, overwhelmingly clear that getting vaccinated, especially 2 shots and definitely with a booster, will give you much broader, longer protection than having gotten naturally infected and then recovered. So that's point number one. Does a natural immunity? Yes, it's important. It helps, but it's not as good as having a full vaccine series. That's the most important issue. The issue of breakthrough infections. Look, almost no vaccine is completely 100% protective against infection. The goals of vaccine are twofold: certainly to prevent infections where possible. But the biggest goal of vaccines is to take what might be a serious disease and make it a mild disease. All the evidence right now is very, very clear. If you've gotten 2 shots of the vaccine, your likelihood of getting into serious trouble is very low, unless you're in one of those high risk groups, in which case a 3rd shot, that booster, can be helpful.
Very clear, and thank you for that. I think that should close the debate on this aspect. Talk a little bit about restrictions. Now, if Omicron is as transmissible as it is, that old idea of contact tracing and containment surely can't work. Should India and the world be looking at restrictions? For instance, travel bans, when they came, were deemed useless for 2021. Where do you stand?
Yeah, I don't think travel bans do very much. Let's just start with that restriction. They could help slow things down by maybe a week or 10 days initially. At this point, Omicron is everywhere in the world. Travel bans makes 0 sense right now. On the issue of restrictions, the question is what kind of restrictions? Do I think people should be locked down? Absolutely not. There is no reason to do it. It won't work. So that should be off the table. But could I imagine restrictions that says, look, no large indoor gatherings where people are not wearing masks. You don't want 500 people in a hall, in a theater, unmasked. That's a very high risk super spreader event. Yeah, I think that would be good to hold off on that right now while the Omicron wave is building. I don't think testing and tracing will be able to contain this. This is moving way too quickly. My point is the infection is going to rage very quickly around the world. We shouldn't feed the fuel by having really, really risky events. That said, otherwise, I think people can go about their way, especially if they're doing things outside. Maybe one minor thing, obviously, we're getting into some political season. There are going to be elections, there are going to be large rallies.
I was just going to ask you about that.
Yeah, so what I think about is, again, outdoors, relatively safe. But if you were in a very packed rally, and we've all seen them, people standing together tight for hours, in that context, I actually think wearing a mask will be very, very helpful. So I'm not suggesting we cancel all the rallies. I'm not saying people should be, but get people to wear a mask in that context. I do think it'll be helpful in those very, very crowded rallies. Otherwise, outdoor masking is not important. Doesn't make a big difference. And avoid the large indoor gatherings as well.
The problem is, how do you police whether people keep their masks on at an election rally? It's impossible.
It is very hard. So my take is that what should happen is you should make it a rule, even if you're not fully enforcing it. Just by making it a rule or a requirement, many people will do it. And then it's up to our political leaders to ask people. If you're at a rally, the political leader comes out, he or she wants to protect his supporters or her supporters. They should ask their supporters, wear a mask for your own benefit and the benefit of your neighbor. You don't need to have a police person for enforcing it. Between asking people to do it and making it a requirement, I think it goes a long way.
So you wouldn't call for the rallies to be cancelled if they're outdoors. You'd say make mask wearing mandatory.
I would. Look, I think there probably is some set of things where it gets just too crowded, where it'll be very hard to contain. But do I think we have to shut everything down, shut all the rallies down? I don't think that's what's necessary at this point in the pandemic. Most people are vaccinated. A large proportion of people are vaccinated, at least with 1 shot. We have masking. Outdoors doesn't spread so much. That combination, I think, makes it a much more reasonable thing to do.
Are you finally coming around to believing that vaccine mandates may be the only way forward?
I am. There's so much misinformation, and there's so many people who've been poisoned by that misinformation, that what will move people is vaccine mandates. And that is what I think we need to do. I think we all want to put this pandemic behind us. The best way to do it is to get a lot more people vaccinated. And the best way to do that is through vaccine mandates.
So, in the Indian context, children is a big debate. Schools, we've had among the world's largest physical lockdown of schools. We just can't afford to keep our schools closed anymore. But we do not yet have vaccines operationalized for children. Where do you stand on children and vaccines?
I think children should be vaccinated. I have 3 children under the age of 18, including a 9-year-old, and they're all vaccinated. And I think that is the right answer. Obviously, they are lower risk. So right now, if India is having to choose between vaccinating a 15-year-old or a 12-year-old or giving a booster to a 70-year-old, I would say in the short run, giving a booster to the 70-year-old makes more sense. But as vaccine supply continues to do very well in India, and India is making a great number of vaccines, I would move quickly towards vaccinating more and more kids. Start with older children, move to younger children. Look, even though they are lower risk than adults, they're still at risk of having complications from this virus. These vaccines are very safe and effective. Last point, though, Barkha, we do not need to wait for vaccines in kids to keep schools open. We know how to keep schools open and safe, and school closings are just a disaster for the next generation. We are robbing India of its most precious resource, which is a well-educated population. We should not be doing that. At this point, all schools should be open. Indoors, you can have kids wear a mask, keep ventilation, open windows. There are plenty of ways of keeping kids and teachers safe in schools.
I'm so glad you said that. It's a bugbear of mine that schools haven't fully opened. Last question, Ashish. What do we know about the therapeutic interventions that are now available? I know Pfizer has a medicine out, and also Omicron. What we did with Delta was we pumped our patients with medicines, whether they worked or they didn't. What do we know about therapeutic interventions when it comes to Omicron and also this new Pfizer pill?
Yeah. Yeah, therapies are going to be a very important part of managing this virus for the long run, because vaccines are going to help, but we'll still see a few breakthroughs. And we're not going to want to do restrictions for the long run. And so therapeutics are going to be very important. There are monoclonal antibodies. Many of them actually don't work against Omicron, so they're being reformulated to work. They're probably a couple of months away. The big news, as you said, Barkha, is Paxlovid. That's the Pfizer pill.
Pfizer.
Just got authorized here in the United States. The good news is it looks terrific. The data on it looks excellent. The bad news is there aren't very many pills available right now. And that is a problem. And we're going to have to figure out how to ramp up global production. This is a place where India has a very large role to play, because as you know, India is the pharmaceutical manufacturing engine of the world. And so the question is, can Indian pharmaceutical companies, which are really world class, what can they do to manufacture lots of these pills? That's going to be the work of the next, few weeks, few months, to make sure these pills become widely available.
I mean, you've given us so many reasons to remember that though it feels like last year, it actually isn't. Thank you, Ashish. Always learn so much when we talk to you, and I know our audience does too. Pleasure as always. Take care and see you soon again. Thank you.
Thank you.
Bye-bye. Bye-bye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.